Absolutely. Medulance is an organization in the emergency response space. Our focus is clear. Help should be given when it matters the most. We've been trying to bridge the gap in emergency response medical transportation services over the last 7 years. I would say we barely scratched the surface. However, over a period of time, we've created a network of about 10,000 ambulances across 100 plus cities in the country. We've saved and assisted more than 50 lakh lives today. I would say barely scratched the surface still. With 5G, I think it allows you to not only take your services to multiple locations. We started using 5G smart ambulances in urban cities, right? And which allows you to relay patient data directly from our ambulances to the emergency rooms of hospitals. I think the focus is clear. We want to improve patient outcomes with the use of 5G. See, I would like to say absolutely the 5G smart ambulance, it's a use case that we've not only launched, imagined, but also it's already being adopted, right? The governments are using it via us hospitals like Narayana, Gleneagles are already using 5G smart ambulances. We've seen, interest from other healthcare institutions as well. Second is, I think, how telemedicine is used. Firstly, that's most important. It's just not a two-way conferencing tool, right? I want to see how we can use telemedicine for specialized doctors as well, right? Even cardiac doctors, even in say someone wants to get an eye checkup done for that matter can happen quickly using 5G from remote locations. You can speak to a doctor, maybe you can even get your eye checked very quickly. Third is actually, we spoke about it in the panel discussion today, is how we can use robotics in surgery. I think it's something very realistic. Again, I keep saying this, driving key patient outcomes would be critical to see how successful it is. But yeah, these would be the top three use cases as per me. Absolutely, yeah. So we actually don't want to rely on a single telecom provider because it's not any exclusivity that we have with one. Over a period of time, we'd love to leverage Bharti Airtel's network, Vodafone's network, anyone else, right, who can support us for our ambulances. Wherever the network is stronger, we would love to work with that service provider. So I would say our aim is to make healthcare accessible to all, right, and for that we need uh, everyone's support who's there in telecom, providing again quick connectivity to the people. No, yeah, I would say that the reason for focusing on in metro cities was that that's where you can get quick adoption, right? As you know, all technologies get adopted very quickly in urban areas. But via this, I want to ensure that this trickles down to tier 2, tier 3 cities because I spoke about it. The real benefit of a 5G smart ambulance actually is in rural areas or tier 2, tier 3 cities where the closest possible multi speciality hospital is about 120 minutes to 180 minutes at times, right? And that's where the intervention is needed. That's where a doctor can give more life saving instructions, monitor the patient remotely over maybe a 2 hour, 3 hour journey, right? And give life saving instructions to the paramedics. And I think that's where the real benefit of the 5G smart ambulance will come into being. However, like every other technology, it needs to be adopted somewhere. That's why we started with urban cities, but the aim is to show real impact in tier 2, tier 3 cities in the country. See, you'll have to work with the right kind of partners, right? As I said, maybe the partner is government, maybe the partner is the National Health Mission, maybe you can work with other hospitals who want to create impact. Maybe you can go the CSR route to do that as well. So the idea is to find the right partners who are focused on creating that kind of impact, believe in your story, right? Believe in the mission. And I think with our focus, we'll find the right people to support us. See, when it comes to say 5G, I'll start with that. See, some of the challenges that you can face is, as I said, connectivity could be a problem. In some areas, even cost could come in as a big problem, right? The government has to spend a lot to create connectivity, maybe in the mountains, other places, hilly areas, for that matter as well. Again, the idea would be data privacy is another very serious concern, I would say, in the same space as well. And when it comes outside of 5G, I think the key challenges that we face, especially in the paramedical sector, I think, yeah, no matter how much technology you involve in any ambulance, there is a paramedic or a doctor that's required. Especially from paramedics' point of view, we need to have more trained personnel in the country, right? I think we need to do more as a country as a whole to provide dedicated institutions for paramedical training, not only to provide the education, but also then to provide hands-on experience. Because if we don't have the necessary trained manpower, an ambulance, even with the necessary equipments, or even 5G, is not going to be much of help. Absolutely. So yeah, it's always necessary to find the right partners. I would say as an organization, we believe that's very clear to us. We've already found, I would say, the right partners. We raised $3 million this year. One of the key aspects for raising money was to spend on technology. And not only the 5G initiative, but technology is an enabler across the organization to ensure that we are not only using it to dispatch ambulances faster, allocate ambulances very quickly, reduce data points such as call answering time, dispatch times, response times overall, and then, of course, the 5G network to support our 5G ambulance.